Well, last month, Australia became the first country in the world to ban social media for children under 16, a move that is reigniting the global debate over teens and screens.
Now, new research here in the U.S. suggests that delaying a child's first cell phone by even just 1 year could have lasting health benefits. CBS News Miami's Buckley is your reporter in Fort Lauderdale, taking a closer look at the toll screens may be taking on our kids.
Kyla Notar-Giacomo has a 7- and 8-year-old. She says it will be a while before they get a phone.
Maybe 13, 14. We'll do like a safe phone of just like numbers for us to reach, but there's not going to be any internet or anything on it.
A new study from the University of Pennsylvania surveyed roughly 10,000 kids across 21 U.S. websites. It found that kids who got phones at age 12 versus age 13 had more than a 60% higher risk of poor sleep and over 40% higher risk of obesity.
So if we're introducing phones at that time, then we are putting them at risk for, poor sleep, difficulty with impulse control, attention. So there's a lot of things that are impacted in that early adolescent stage.
Dr. Amanda Alvarez is a child adolescent psychologist at Nicholas Children's Hospital. She says ages 11 to 13 are a sensitive period for emotional regulation. She suggests being proactive and prioritizing balance when it comes to screen time and cell phones. The Bensons' preteen grandkids follow those guidelines.
They can't be on screen time on Tuesday and Thursdays, and their homework has to be done.
That was a really hard decision. He got his phone really when he turned 9, so recently.
Pamela Goodwin's 10-year-old son has a cell phone for communication purposes, but there are rules. She limits his screen time and accessibility.
He's not allowed on social media. He can call, chit chat, but I do see the messages, I do see the calls, I can monitor it.
The Notar-Giacomos know that same discussion is coming and plan to lead by example.
I'm going to be very honest and open to them, and you can't block them forever, but I also want them to realize the whys behind it.
This is going to be a part of our lives now, right? So we want to be able to avoid any negative consequences and be more proactive than reactive.
If you're worried that your child has too much screen time, Dr. Alvarez says keep an eye on these signs. If you try to reduce screen time and they become irritable, have withdrawal, isolation, or increased impulsivity, she says it might be time to cut back. In Fort Lauderdale, Buckley, CBS News, Miami.